Hello, hello. Today we are going over some of my favorite tips and tricks for some of the most commonly prescribed supplements that I see. These are things that people are frequently coming in already taking when I see them in my doctor's office, and they're some of the most commonly used supplements out there. And definitely, if you guys end up liking this series, I can do more on different supplements. So today we're going to be covering 3 main supplements, and then hopefully we can go down the rabbit hole with a bunch more in future episodes. And the reason I wanted to do this is because there is a lot of nuance when it comes to supplementation. There are so many different brands out there, so many different formulations, and a lot of the times people are taking things with the best intention, but they might be dosing it wrong or not aware of the quality control issues with a lot of these products. And these are nuances that I spent years of my life learning. And so hopefully I can pass some of that knowledge on to you guys, because a lot of you are doing the right things in the sense that you have the right idea, but there's just a little bit of tweaking that's required. Of course, you should always see a doctor, especially one who's very well versed in supplements if you really, really want to dive into it. But hopefully today I can provide some helpful tips and tricks to prevent you from taking things incorrectly and wasting your money on supplements that aren't going to do anything for you. Okay, so I'm not going to waste too much more of your time. So let me just briefly introduce myself and then we'll get into it. My name is Robin Lewis. I'm a naturopathic physician practicing here in Vancouver, British Columbia, Canada. And because I'm a naturopathic doctor, we have learned a lot about supplements. So I do feel really confident on this episode. This is very much in my wheelhouse. The first one I want to talk to you about are the omega-3s. So this is coming from places like our fish and seafood. It can come from plant-based sources like algae, flaxseed, chia seed. There's different versions of omega-3s in those plant-based versus animal-based versus algae. But either way, it's one of the most common supplements I see people taking already when they come into my office, or I also prescribe a lot of it. They're incredibly important for so many aspects of our body, including our brain health, our cardiovascular health, our overall inflammation, joint health. Omega-3s are very important, and one of the reasons it's something I prescribe a lot of or see a lot of people taking is because, generally speaking, especially here in North America, we're very commonly deficient in omega-3s. And this is because we don't eat a lot of seafood on our day-to-day basis, unlike some other places in the world. They say that a vast majority of the people in North America are deficient in omega-3s, and that's going to have knock-on effects to our health. And so taking an omega-3 supplement is very important, especially if you don't eat fish around 4 or more times a week, but a lot of people are doing it incorrectly. The first thing I want to mention about this particular category of supplements are that they are very susceptible to poor manufacturing, meaning the quality of your supplement really, really matters. And this is in part due to the fact that it's an oil. So oils can go rancid if they're not manufactured properly. There can be a lot of contaminants within those oils if, again, not manufactured properly. So I'm actually quite picky about which fish oils I will choose, because if it's, let's say, overheated during the manufacturing process, you can actually take this very anti-inflammatory, very good for you oil, turn it rancid, and then it's actually more pro-inflammatory. So you can take something that is very good for you and actually make it bad for you due to this poor manufacturing. And so a couple tips and tricks I would say around that do kind of apply to almost all supplements, but for some, they're a lot more vulnerable than others, with omega-3s being one of them. So first thing is, we want ideally for some sort of third-party testing. This means a company outside of that company doing the quality control test. Now, supplements are not required to do this in most places of the world. So this is someone going above and beyond to prove that what is in that product is actually in the end product. There is the accurate amount of omega-3s within there. They've checked for contaminants. They've made sure that the beginning and the end product, there's nothing gone wrong in between, sort of thing. And then there should be something on their website about their quality control. These companies, especially like the professional grade companies that I like to use, they love to talk about their quality control because they're proud of it. They've gone above and beyond to ensure the quality of that product. And so those are a couple things to look out for. There's quite a few different types of companies that do this third-party testing, but that's always a good sign. And then if there's something on their website that kind of goes over how they quality control within their domain, that's also a very good sign. And so that's the first thing I would say, is just really care where it's coming from. If the product is super cheap, it's probably because they cut corners on some of these steps. Now, the second thing I want you to pay attention to is how much actual omega-3 is contained within that product. So what you'll see a lot of the times with omega-3s is on the back label, they'll just mention how much oil is in that product. So typically speaking, omega-3s are being dosed around 1 gram to 3 gram for a therapeutic dose. And that is of 1 to 3 grams of pure omega-3, not filler oil. So this is a really tricky place where you can get a little confused, is within that label, there should be a specific part that mentions how many omega-3s are in it. So a lot of these cheaper supplements will have 1 to 3 gram of oil, but only a small percentage of that is actual omega-3. And of course, that's the part you're paying for. That's the part you want. And so we don't want a lot of filler oils. We want pure omega-3, or as high amount as possible. And then that's where you're basing your dosage off of, is that amount within it, not the overall oil, but the actual omega-3. If you look at the label, there's 2 main omega-3s that are active within the body. There's DHA and EPA. So sometimes you'll see that there is however much EPA, however much DHA, and then that would count towards your omegas, your total omega content. When it comes to animal-based versus plant-based omega-3s, there is also one other discrepancy I should tell you about, and that is the fact that most often, unless it's an algae oil, the plant-based versions are in the form of something called ALA, which needs to get converted to EPA and DHA inside the body. So it's an indirect omega-3. The EPA and DHA are what do all of the things in the body. They're the active ingredients that we really, really want. Algae oil does have DHA, but none of the other plant-based versions have either EPA or DHA. They would have ALA that needs conversion inside the body. So you'll notice that on the labels. It's a big reason why algae oil is my favorite of the plant-based versions. But if you're not fussed about plant-based versus not plant-based, then you might want to opt for a pure fish oil because they're a more direct version of the EPA and DHA, and just pay attention to that label to make sure you're getting therapeutic amounts of omega-3s, not of random other oils. Now, you might be wondering which brands are best, and that's a hard question to answer because what I have available to me in Canada is different than what I have available to me in other parts of the world. And I do use a lot of these professional grade supplements, which might be harder to get out in the wild just off of Amazon or something like that. But some of the brands I really like would be things like NFH, Designs for Health, we've got Cytomatrix, a couple of the over-counter ones like Nutrici or Aqua Omega. There's a lot of supplements, so you might have to do some of your own research because these are just some of the ones that are available to me here in Canada, which is quite limited. There's a couple more things I want to mention about omega-3s before I wrap up here. The other one is how you store your omega-3s. So as I said before, these oils are very vulnerable to poor manufacturing. It's because they're sensitive to things like heat and light. Those will break down the omega and make it go rancid faster. So even with your good quality omega-3s, probably best to keep them in the fridge away from heat and away from light, because that'll preserve them for longer. So yes, even if you have one of the best ones on the market, if you put it next to your oven and there's exposed to unnecessary amounts of heat, it will go quicker. And then final thing that I want to mention on this is take your omega-3s with food. They actually have been shown to absorb a bit better with food. And then the other reason is people can feel nauseous, especially if they're taking higher amounts of it, higher dosages, if they have it on an empty stomach. You see this with a couple supplements. Things like B vitamins are very notorious for it, actually more notorious than omega-3s. But a couple of these supplements are really well known for creating things like nausea, diarrhea, and things like that if you don't take them with food. So some people are sensitive to fish oils or omega-3s in that regard. Not everyone, but better safe than sorry. Just take it with food. It absorbs a little bit better. You're less likely to get some of those side effects. And if you are getting those side effects, even with food, maybe it's best to separate that dosage out. So maybe you take 1 gram with breakfast and 1 gram with dinner, as opposed to 2 grams with one meal, if that makes sense. And so that also brings me to the next supplement that I want to talk about, and that are the B vitamins, which is a broad category. We have many different types of B vitamins. So I'm just going to talk about them as a general, but of course there is a little bit of nuance if you look at the individual B vitamins like B9, B12, things like that. And B vitamins are one of my favorite categories of supplements because they're used so much throughout the body and they're very underrated. I feel like people forget the value of something as simple as a B vitamin. And as I mentioned earlier, yes, you can get gastric upset, nausea with B vitamins, especially like a B complex or something. But also keep in mind that a lot of supplements love to throw B vitamins into their larger formulas. And sometimes the dose is low enough that it won't create this problem. But if you are taking one of these supplements that has many different ingredients and you're wondering why you don't feel great while taking it, a little queasy, things like that, it might be because there's some B vitamins in there, and it might be because you're not taking it with food. There are different levels of sensitivity to B vitamins on an empty stomach, but I myself personally am quite sensitive to them if I don't have enough food with them. So the easy solution is take food with it, and do keep in mind that it sneaks its way into a lot of formulas. A lot of different formulas will throw in around B5, B9, B12 into the overarching formula for a lot of good reasons, but it can make you a little bit digestively upset. And then another very important thing to keep in mind is that there are different versions of the B vitamins that can be found in different supplements. And so what I mean by that is there are inactive versions of B vitamins and active versions of B vitamins. If you're taking the inactive versions, which are usually the cheaper versions, then those need to get converted inside the body through various different steps to their more active form. And what I mean by more active form is like that's the form of B that will go around doing things in the body and creating the benefit that you're trying to create by taking that thing. And so sometimes this is not a big deal, but in other times people are what we consider poor converters, which means that they don't efficiently activate that B vitamin inside the body. A really good example of this is B9 and B12, to be fair. You see these particular B vitamins heavily affected by genetic variations. One of the more common ones we talk about are methylation issues. I did a whole video on methylation, and so if you want to learn more about that, please check it out. It is a very common genetic variation that makes you unable to convert inactive B9 into active B9 and can also have implications with B12 as well. And so the solution in people who have these genetic variations is to try and give the active form. There are some nuances here, especially if someone is quite ill. You definitely want to be doing this with a healthcare provider because there are some funny things that can go on. But it will be the difference between taking something that actually works and taking something that doesn't really feel like it's doing much in the body or is even making the problem worse. And so I will provide a list of the active versions of these B vitamins, B1, 3, all the way down. So these are things to look out for when you're looking at the quality of your multi-B vitamin or your B9 or your B12 supplement. Are they giving you the active form or are they giving you the inactive form? And so this definitely matters, especially if someone has some of these genetic variations. Some people are lucky and they don't, but a lot of people are not lucky and they do need to take the more expensive versions of these supplements. And the last thing I want to mention on the topic of B vitamins is this can also be seen with the injectable versions. I've had a couple patients coming in who were prescribed injectable B12 usually, maybe a B complex. Maybe they tested low on blood tests for B12, for example, which is very common in a lot of demographics. Again, like omega-3s, very common deficiencies. B12 deficiencies are seen a lot in people who have chronic illness. People who eat more plant-based can be really low in B12. There's a lot of different populations of people who can have low B12. And so in those cases, because they're quite low, sometimes they'll be asked to do injectable B vitamins or B9 into the shoulder or the glute sometimes, or it can be found in IV formulas. So if you go to get nutrient IVs, they can infuse these B vitamins, but they can also be found in the active form versus the inactive form. And I've seen it before where for whatever reason, their doctor prescribed them the inactive version of B9 and B12, and then they didn't notice a difference. We switched them to the active version of B9 and 12, and then they start to notice an improvement. And so even if it's being prescribed by a doctor, ask questions. Understand what is going into your body so that you are making sure that you are giving that supplement a fair shot. You're giving that nutrient an opportunity to have an effect in the body and not just discounting its in effect to it not working for you. Maybe it does work for you, you're just taking the wrong form of it. Okay, so that's all I'm going to say about the B vitamins, just a couple tips and tricks, some common things that I don't think are common knowledge sort of thing. Now let's go on to the last supplement that I want to talk about, and this has got to be one of the most common supplements ever. Like, I swear I didn't look up the stats, but if there were stats out there, this has got to be on the top 5 of most used products out there, and that is vitamin C. You see a lot of people taking vitamin C for most often immune system reasons. They want to prevent cold and flus. They want to get over a cold or a flu quicker. I use it for a lot of things. Vitamin C is a very useful antioxidant inside of the body. I use it a lot when I'm prescribing things to help with the recovery after I do some of my joint rehab injections. It's very good for collagen production, so the repair of joints and ligaments. It's very useful for the collagen inside our skin for anti-aging purposes. There are a lot of different uses of vitamin C, and so it's a really great supplement, but you typically do want to dose it quite high in order to have a therapeutic effect. Some people will take small amounts of it more prevention-wise, and that's okay, but if you want to have an effect like recovering quicker from a cold, for example, you usually want to be dosing around 1 to 3 grams a day, which can be an issue if you're on a poorly absorbed version of ascorbic acid. The reason for this is if you can't absorb all of that 1 to 3 grams at once, what it'll do is it'll attract water into your intestines and create a diarrhea picture or a loose stool picture. And so there's a couple things you can do to enhance the absorption of that vitamin C. A, because if it's not absorbing, it's a waste of your money. And B, we probably don't want those side effects. And so the big thing is ascorbic acid actually absorbs a lot better when combined with something called bioflavonoids, which are naturally occurring compounds that would normally occur together in nature. So say you had an orange, for example, it usually has a high amount of ascorbic acid and bioflavonoids, and those two have a synergistic effect helping you absorb that ascorbic acid better. So there's a couple companies out there like Thorne, Designs for Health, Natural Factors, and I'm sure more that will combine their ascorbic acid with the bioflavonoids, making the chances of loose stools far, far less and the absorption far, far higher. So that is a very useful tip for a lot of people, is like, okay, how do I maximize the benefits out of that supplement? That's how you would do it. You would find a combination. You actually see this a couple times where there are things that would naturally occur together that can have a synergistic effect. It's very interesting to think about, but vitamin C or ascorbic acid is a very good example of that. And even if you have these well-absorbed versions, very good quality supplements, you can still get that effect if you take too much at once. So if you are taking that amount and still getting the loose stools, usually the solution is to just take less all at once. So maybe separating that dose throughout the day. So if you still want to hit that 3 grams a day for whatever reason, you and your doctor decided that's your therapeutic dose, what you can do if you start to notice loose stools is you can have 1 gram earlier in the day, midday, and in the evening, or 1.5 grams on breakfast and dinner sort of thing. Separating the dose so that your absorption is better of that ingredient. So those are some things to think about when orally taking vitamin C. The last thing I want to mention is similar with the B vitamins, it goes into a lot of IV formulas. So you'll see vitamin C in virtually all nutrient IVs. It's not in every single one of them, but it's a very common ingredient. And I'll have patients coming in asking, I just want a lot of vitamin C, high dose my vitamin C. There is technically a difference between high dose vitamin C and lower dose vitamin C when you're putting it into the bloodstream directly, so intravenously. So anything above 25 grams of vitamin C, so you can take a lot of vitamin C in one go, but if it's above 25 grams per sitting, that's what we consider high dose. And high dose vitamin C actually does something very different in the body versus low dose. At low dose, it's an antioxidant. It's doing all of those things that you know vitamin C for. In high dose, it's actually acting as a pro-oxidant. So that's actually more useful in the context of things like cancer and chronic infections. And so this is more of just like a language nuance. When you say I want high dose vitamin C IVs, you probably don't actually want high dose, technically, vitamin C IVs, because those are their own special category of IVs. And the pro-oxidation is to kill things off, to help kill off cancer cells, to help kill off chronic viruses, chronic bacteria, things like that. It's trying to create an environment that is not great for those particular things. So if you don't have those particular things, you probably don't want high dose vitamin C. It's not really useful in the way that you want it to be useful. And so that's just the last thing I wanted to say about that, because it's a very common thing that I'll have people come in asking for. And if you don't understand the difference, it's really important to understand the difference. And that's really it. I just wanted to touch on a couple, do a little bit of a quick fire, helpful tips and tricks, common errors I see people making when taking these supplements, when asking about these things from their doctor. And so again, if there are any other supplements that you'd like me to do this on, please let me know. If you enjoy this style of videos, also let me know. And yeah, if you have any questions about anything that I said today, please let me know. Thank you again for listening, and hopefully I'll see you again soon.